Monkeypox is here. Here are the 3 things that you need to know to keep yourself safe and to keep yourself healthy. First thing that you need to know is what is monkeypox? Well, monkeypox is if you will, a genetic variant of a virus that we knew from long ago. It's called smallpox. Unfortunately, a lot of the national media has given people the impression that monkeypox is no worse than just a case of chickenpox. It makes you a little bit sick, and you get this rash, and then it kind of runs its course and it goes away. But I need to call you back to the fact that it's not a variant of chickenpox. It's a variant of smallpox. Smallpox, a viral illness that nearly wiped out an entire population in this country. When those who came from England came to the United States, they infected a lot of the Native Americans with smallpox, and it nearly completely decimated the Native American population in this country. It's a very serious illness. One of the things that I want to talk to you about is how it spreads. Monkeypox is a viral illness that starts with usually upper respiratory related symptoms, much like the flu. You can have a fever, you can have chills, you can have body aches, sore throat, upper respiratory type symptoms. Usually within about 1 to 4 days after those upper respiratory symptoms present, you can start noticing a rash. That rash starts out looking almost like acne. You can have very nodular lesions that can occur almost anywhere in your body, whether it be down in your genital urinary area, whether it be on your hands, your lips, your face, your feet, the palms, and the soles thereof. That's where the rash usually presents. Unlike chickenpox, chickenpox usually starts in your torso and spreads out. Monkeypox starts from the outside and generally spreads in. It can be very painful, they can be very itchy lesions, and they can spread very quickly. You can wake up one morning with a few little lesions, and by that afternoon, they can be spread throughout most of your body. It's very dangerous. When I say it's very dangerous, what do I mean by that? Well, we'd spent a lot of time talking about the COVID-19 pandemic. The COVID-19 pandemic that claimed 750,000 plus American lives over the course of about a 2.5-year period. COVID-19, although it spread much more readily and much more easily than monkeypox does, was much less lethal. Less than 1% of people who were infected with COVID-19 actually succumbed to COVID-19. There were some studies on monkeypox in Africa and more remote regions where they saw a death rate of up to 11% from monkeypox infestation and infection, which is in part why the CDC has now made it a disease of severe concern in this country, because it's spreading and it's spreading. How do you catch it? Well, generally by direct contact. If you come in contact with someone who's got monkeypox lesions and you touch those lesions, particularly the secretions from those lesions, you then have basically contracted that viral infection. Other ways that you can do it is by touching things that people who have had lesions have touched. Their clothing, their bedding, towels, even inanimate objects like doorknobs. If someone's got lesions on their hand and they touch the doorknob that you then touch without it being sanitized prior to you touching it, you can contract the virus in that way. A lot of people have focused on the fact that the majority or the largest demographic of patients who have monkeypox are men who have sex with men, making them feel as though they're immune from it. That's a false perception. Even though that seems to be where the greatest demographic is, it's already started crossing over out of that subpopulation. We're seeing more women contract it, and we even now have children who are born with monkeypox, who came from a mother who was previously infected. So it's starting to spill over into the general population, and as you just noticed, the mode of transmission is one that anybody is susceptible if you don't take the proper precautions. What are those precautions? Well, we're going back to what we knew about COVID-19. Frequent hand washing, it's critical. Sanitizing your hands frequently, it's critical because, like I mentioned, if you touch an infected surface from someone who passed before you who had monkeypox, you can get it without ever knowing that you came in contact with it. Keeping your hands out of your face is also important. If you're not in a position where you can wash or sanitize after you've been out on an excursion outside of your own home that should be relatively well protected, then you need to be sure that you keep your hands out of your face until you're in a position where you can properly wash and or sanitize your hands. Be sure that if you're around anyone who has suspicious lesions, that you're very cautious not to have close intimate contact with that individual. Hugging, kissing, sexual contact, using their toothbrush, drinking after them, those are all ways that you can contract the viral infection. As of this date, to our knowledge, monkeypox is not an airborne virus. It's still relatively a direct contact infection based upon secretions from an infected individual. Okay, so now if someone who's got monkeypox and develops a cough or sneezes on you, that sputum can very well be infected sputum and you can contract it that way. So we go back to what? 6 feet social distancing. A lot of the things we learned through the COVID-19 pandemic can be very valuable as we see the continued spread of monkeypox in this country. What can we do about it? Well, let's get to the next point. The next thing that we can do and the next thing that is available is vaccination. Well, how can we vaccinate against a viral infection that's relatively new to this area? As we discussed earlier, monkeypox is a variant of smallpox. We've had smallpox vaccinations available to us for generations. And it seems as though those smallpox vaccines can be very effective at preventing actual infection from the monkeypox virus. So those are available. Well, why are we all getting vaccinated, Dr. Ellis? At this point, the CDC has basically limited the people who they think should be vaccinated because there's not a great surplus of these vaccines. And who are those people? Well, people that they consider to be at high risk. Men who have sex with men, people who have known contact with someone who has monkeypox, and those people who are in a position where they're going to be in direct contact with monkeypox patients, either as providers and caretakers and or lab technicians who are going to be processing these specimens that are going to be collected to make the diagnosis and initiate treatment for these individuals. And then lastly, how do we treat monkeypox? Well, here's the bad news. We really don't have any treatments for monkeypox. We have some antiviral agents that were useful for smallpox that they're using in a limited supply and on a limited number of patients who are at severe risk of bad disease. Those are people who are immunocompromised in some way. Folks who may have HIV and AIDS, people who are on chemotherapeutic agents or other immunosuppressive drugs that possibly could have a viral infection that could blossom and lead to a morbidity or a death. So those are the only cases at this point that we're actually using antiviral drugs to treat monkeypox. So your best protection is to make sure that you are trying to be as safe as possible. 6 feet social distancing when you're in indoor areas. Make sure you're continuing to wash your hands frequently. Use hand sanitizer frequently and keep your hands out of your face. All sounds very familiar, doesn't it? Stay in tune. We're going to continue to bring out more information about this infectious process as more information is made available. Make sure that you hit the like. Make sure you hit the subscribe. And very importantly, make sure you hit that bell notification so that as we get more information and bring out more information, you're on the cutting edge and be able to hear it first. God bless you.